Good morning and welcome to the Justice Reinvestment Advisory Council. My name is Chris Goff. I serve as an Associate Justice on the Indiana Supreme Court, and I've been designated by Chief Justice Loretta Rush to serve as chair of the state JRAC. We will be conducting a roll call vote for all action items today as we have members or proxies joining us virtually. And I'd first like to welcome any new members or new faces. We do have a new member coming on, Sheriff Ballin, but he's not able to join us today.
Correct.
But we do have Steve Luce here from the Indiana Sheriff's Association. We do have some other new faces that are here today for presentations, and in the interest of time, we're going to have a minute at the end where we're going to ask for some report outs from all the different agencies, and so just ask for introductions and sharing some thoughts about the important work that your agencies or offices might be doing to benefit the work of JRAC. With that said, our first item of business is approval of our December 19th, 2025 proposed meeting minutes. The minutes from our December 2025 meeting were sent to members prior to this meeting, and at this time, I would welcome any recommended changes, or if there are none, a motion to approve.
I'll make a motion.
Thank you, Steve. There is a motion from Steve to approve, and there is a second from Doug. Any further discussion? Yeah, I will call then for a roll vote. I believe that we have participating virtually Danny Price. Danny, are you able to hear me?
Yes, I can hear you, Judge.
Okay, hello, Danny. Good morning. Danny,
Good morning.
Calling the question then, do you vote to approve the proposed minutes from our December 2025 meeting?
I vote to approve, yes.
Thank you, sir. Anthony?
Yes.
Steve?
Yes.
Becky?
Yes.
Doug?
Yes.
Chris?
Yes.
Judge Spitzer?
Yes.
Steve?
Yes.
Bernice?
Abstain.
Okay. Chris?
Yes.
Adam?
Yes.
Carolyn?
Yes.
Ashley?
Yes.
David?
Yes.
I think that's everybody's a voting member, so thank you. Thank you. The minutes will stand approved as presented. We're now going to ask for report outs from our JRAC work groups. The first report out will come from Chris Bean, and his report out is going to relate to the work that's been done with our local JRAC work group. Chris asked, can you share information regarding the ongoing Center for Effective Public Policy technical assistance, as well as the 2025 local JRAC annual report?
Yes, sir. So CPP continues to work with actively 14 counties right now. In addition to those 14 counties, they continue to work with us at the state JRAC level. They have served as an invaluable sort of sounding board for me as we get to what I'm about to talk about, and that is the release of the 2025 annual report survey. But they have now worked with all but I think 40 total counties. So CPP, through the sort of the history of EBDM and now JRAC, have worked with 52 counties, continue to have an open, ongoing application for technical assistance at whatever level the requesting county desires. Then moving on, the 2025 annual report survey is now done. It's just now me getting over the hit send to all 92 counties and waiting for the responses that always comes on a Friday at 3 p.m. I want to thank Ashley Stevens. She served as a bit of a guinea pig. I sent it to her. She tested it. Gave her thumbs up on not the structure of it or anything else other than just that it works. So which is enough for me as a 48-year-old man. I'm all right with it if I can get it to work. Riley Summers and some other internal folks have also played guinea pig with it. So now we just hit send and hope and pray at that point that things go out and come back. So as noted at previous meetings, this year we've added quite a bit. There is a bit more around CCBHC's requests for any kind of information or technical assistance for those. There's more on the opioid settlement funding. There are also questions around other sort of fiscal considerations from the counties as we try to get a good understanding of the impacts of the current fiscal environment. I've actually spoken with a number of chief probation officers over the last week where they say, how do we tell you where we're struggling? And I've said, this survey's coming out, please be honest. So the survey will be due back March 31st. I'll say it here, I say it to anybody I send it to. If that doesn't align with their local JRAC meetings and they need another couple of weeks to turn it in, I would much rather they actually meet as a local JRAC to discuss and give us really good information rather than trying to meet that deadline and just sending it in. There's, without a doubt, every year I send this out, within 2 hours of me sending it out, I will have received responses. So that box is checked for those counties. We don't get a lot from that. So if any of the counties are on the stream, feel free to be late, just be thorough.
I think that's worth mentioning, Chris. Anybody that is interested that might be listening, we really want to be communicating as efficiently, as quickly as possible so that we're in a better position to meet our statutory charge to ensure that our community-based justice systems have access to all of the best evidence-based recidivism reduction programs that we can make available. That is our statutory charge. We have a lot that we can offer in terms of technical assistance, and this is really an opportunity for them to communicate up to us what they need. We really want our conversations and our service to Hoosiers to be driven by local need. So, anything else to report?
No, I think just also Reform Alliance, who has come to the state JRAC meeting. They went to the Floyd Summit back in, I think, October or November, but have taken some interest in probation and community corrections in the state. They've met with us a couple of times to see what they can offer to counties around probation and other community supervision. They also took a look at the survey just to work on some of the language, helping me wordsmith any of the questions, but also adding questions or selections that might be a bit more sort of enlightening of what probation departments, community corrections agencies are really struggling with.
Thank you, Chris. Thank you, Ashley, for going above and beyond as usual. We know you're a busy chief probation officer and community corrections obligations, but your service to your professional organization and helping us is really appreciated at the state level, so thank you. And Riley, thank you as always for all the support that you're able to provide from staff. Chris, excellent report. Thank you. As always, do any members have any questions for Chris regarding the local JRAC work group updates and the technical assistance from CEPP? One thing I might just throw out for discussion and thought in this time where we are seeing increasing financial challenges, I've been having through my administrative responsibilities some separate conversations with our newly stood up Judicial Resources Work Group and also been dealing recently with issues of judicial security. So we had a recent shooting, as I think most of you know, in Tippecanoe County. And the thought is that we ought to be as responsive as we can be to local needs, and maybe going forward we open up those items that communities can ask us for in terms of technical assistance, but also perhaps general up the requests for our grant funding and start thinking about them in terms of sustainability. Even perhaps describing them that way, because that's how I view them, as court sustainability, justice sustainability grants. We know that our county-based justice systems are under increasing financial pressure. I don't think that that's going to necessarily change, and I really feel it's probably important for us to be as responsive as we can. So if all of you, have a strong disagreement with that, I'd love to hear it. If there's any thoughts that you have about that, I'd love to just kind of continue that conversation. But those are just some thoughts that I've had as I've been listening to several different stakeholders over the last several weeks. So Anything else before we move on in the agenda? Any thoughts, concerns, questions? Yeah, Bernice.
This comment or thought may be adjacent to the use to stood up work group, but something I did want to, I've raised before, and maybe now is a good time to raise it again, is when we think about PD participation in local JRACs, it's generally really difficult for PDs to participate. Not every county is like Marion County, where you have a full-time office and
Yeah.
a chief whose job it is to be at local JRAC meetings. In many instances, thanks, Chris. In many instances, we're dealing with a PD system where an attorney is contracted to represent in certain courts or certain case types, but that's the limit of their job. Otherwise, they have a private practice.
Yeah.
So if they attend JRAC, they're the only person around the table who's not being compensated. It's not part of their job to do it. So I would like to just revisit, are there ways to make sure that attorneys who are contracted in counties who are to be at local JRAC are also compensated, like their contract includes that and they can bill for that time?
Yeah, thank you for that thought, Bernice. I understand the need. I worked in a county like that, and I was such a public defender at one time, so I certainly understand the need. Are there any other thoughts? Well, thank you again, and appreciate all of the input from members, and would ask then to receive a report out from our data work group. And Angie Hensley is here. Angie, can you please give us a report out from the work that's been done with our data work group since we last met?
Yes, we've held 2 meetings so far in 2026, the most recent being on February 9th. We did discuss a survey that's been created for members to assist with developing the data inventory that we've been working on. The next steps for that will be we're going to meet again on March 11th, or I'm sorry, March 12th, to kind of finalize prior to that and then hopefully send that out. We are also looking at the strategic plan to identify some future activities, one of which being looking at maybe what data resources are being collected, looking at the annual reports and seeing where they're struggling to collect certain things, and seeing if we could offer some guidance, like more generally to local JRACs, where they could look for certain data points that they're trying to find or might need. So that's kind of next on the agenda. So
Thank you, Angie. Do any members have questions for Angie regarding her report out from our data work group? Well, Angie, I appreciate you and our members for the hard work that you're doing and will continue to do, so that we can do our best to collect information. Always a challenge because we have a non-unified justice system in our state, our 91 county-based systems, one consolidated system. Do things a little bit differently, and as we're trying to fund and resource up our community-based, our county-based systems, one of the things we need to rely on is better data. So this is important work, and trust that you all are going to be able to deliver some things that will help us communicate better, not only with our local partners, but with our partners in the General Assembly. So thank you very much. Now ask for a report out from our reports work group, and Michelle Goodman is here. We will have 2 voting or action items with respect to our reports work group report out. And again, we'll have to do a roll call vote. My thought and my hope is that we'll be able to take both of these reports for a single vote. So with that in mind, Michelle, can you please give us a report out?
Thank you, sir. In your materials that our team sent out, we had provided an excerpt of Q2 report. It has the cover page and then just 1 page following. Unfortunately, our team found a missing item, and so it's reflected on that 1 page. We added a number. It was a blank. Our apologies for oversight in not having that. So that's the reason that we're asking for an amended approval of Report 2, is because we found a missing data element. So you can see that in the track changes right there in the page on that about the number of contractors that collect fees. The other item in your materials is the Q3 report in its entirety. So you can see all the track changes through that report of the elements collected from the local JRACs for Q3. So those are the 2 elements of reports for your review and approval, and then we'll be able to post once that's made available. If you have any questions, I'll do my best to answer those. The only other report, which is just information, is quarter 4 is still pending. They're due at the end of this month, so we're still collecting those and following up with folks. So,
Thank you, Michelle. Do any members have questions for Michelle regarding her report out on our reports work group? Seeing none, Michelle, are we ready then to call for the question?
motion.
Yeah. So you've heard Michelle's report regarding the work of the reports work group. If there are no questions and there are no changes or corrections to be made, I would ask for a motion to approve the reports as presented.
So moved.
Okay, thank you, Bernice. There is a motion. Is there a second?
Second.
Okay, thank you, Judge. So we do have a motion and a second to approve the reports as submitted and reported by Michelle. I will call for the roll vote. Danny, are you still able to hear me?
Yes, sir.
Do you vote to approve the reports as submitted?
I vote to approve. Yes, sir.
All right, thank you. Anthony?
Yes.
Steve?
Aye.
Becky?
Yes.
Doug?
Yes.
Christine?
Yes.
Judge?
Yes.
Steve?
Aye.
Bernice?
Aye.
Chris?
Yes.
Adam?
Yes.
Carolyn? Ashley?
Yes.
David?
Yes.
Thank you. The reports will stand approved as presented. Anything else to report, Michelle?
No, sir. Thank you.
All right, thank you. That does conclude then our report outs from our work groups. Kind of excited today. We're going to receive two presentations, and first we're going to hear from Brittany Kelly, who is here on behalf of our Office of Behavioral Health. Brittany has joined us today to provide an update on their activities and initiatives. So, Brittany, you have the floor.
Thank you, Justice Scott. One moment while we get situated here. Thank you. You can be sharing this slide. Okay, thanks. Well, while she's queuing up the slides, I'm really excited to be back. Can you hear me? I don't think these amplify
Closer.
stream. So if you can't hear me at any point, please wave or something, because there's a really loud air conditioning unit. But I'm really excited to be back. I was last in front of this group when the Office of Behavioral Health was first created, which has been almost 2 years now. So I have a lot more to tell you than I had at that time. It's not on. One moment. There we go. Okay. So first of all, has anyone read this report by chance? This is the State Courts Leading Change National Judicial Task Force report to examine state courts' response to mental illness. It's okay if not, but if not, I would strongly encourage you to start here if you're interested in, how this began, how this office was created, and really where we are nationally in this movement. Justice Goff and Chief Justice Rush were both very involved in the creation of this report. Here are a few of the recommendations in the report, not even all of them, but you can take a look. Things like reforming the competency to stand trial system, deflecting and diverting people to treatment, centering people with lived experience, children, youth, and families, data and information sharing are all in this national report. But I do have a favorite recommendation that I'm pretty fond of, which was Resolution 1 that was adopted by CCJ and COSCA. It stands for the Conference of Chief Justices and the Conference of State Court Administrators. And it said that state courts should consider appointing a behavioral health expert and a team to really permeate these responses through the trial courts. And that is where I come in and where the Office of Behavioral Health comes in. So Chief Justice Rush acted on that recommendation by creating the Office of Behavioral Health in May of 2024. Succinctly, the office's mission is there on the left. It says that the office prioritizes the behavioral health related needs of Indiana's courts and the litigants that they serve. But then on the right, you can see the 3 ways that the office really does that. First is to connect justice system professionals to resources in their communities. A lot of times those resources are all of you. And I just act as a connector, connecting people to you and other state resources. I provide education on matters of behavioral health. In the first 2 years, it's become evident that treatment providers really want to better understand the courts, and the courts want to better understand the treatment landscape. So a lot of education and a lot of cross-training has happened over the last 2 years and will continue. And then I also support the Behavioral Health Committee that was created at the same time that the Office of Behavioral Health was created, and that's made up of 15 judicial officers who raised their hand and said, I want to be part of this, I want to lead this movement. It's chaired by Judge Stephanie Campbell, who, if you remember, was here with me back in 2024 when the office, again, was first created. And this group has been very busy. I'll tell you a little bit more about what they've been up to, but you can take a look and see if you recognize any names from your community. So this is something that this group knows intimately well, but I think it bears restating because it really is the undercurrent to the work of the Office of Behavioral Health, and also I think to the work of this group of JRAC. So we know that the justice system is the de facto entry point for obtaining treatment and services. We know that the criminal justice system is the primary referral source to substance use disorder treatment and the largest provider of mental health care. And then we know that correctional institutions have become de facto mental health providers when they were never intended to operate as such. So here's what the first 2 years have looked like. We're pretty high level in the Office of Behavioral Health. As I mentioned, I serve as a resource to Indiana's judicial officers. So judges can call me anytime, and they have. Sometimes something as simple as, I don't even know who my community mental health center is. Where do I start? And sometimes, something advanced like, I have a big idea, or I want to start a big initiative in my community. Again, like I said, I support the Behavioral Health Committee. We're going to come back to that. I'm going to tell you a little more about what's coming from them. Fostering key stakeholder relationships has been essential to the office in the first 2 years. Those relationships are with all of you. This doesn't work if there's not strong relationships with DMHA, the Indiana Council, Mental Health America, DOC, the Sheriff's Association, IPAC, IPDC, probation officers, literally every single one of you at this table. There has to be a strong relationship so that I can connect people to you and we can work together. I offer guidance internally to OJA. So the Office of Behavioral Health was created as a standalone agency for a reason, not embedded in another agency like the Office of Court Services, and that was really so these responses and these best practice can permeate the Office of Judicial Administration as a whole. So I've provided guidance on best practice language when we're amending rules, peers in problem-solving courts, got some help from DMHA with that one, just other kinds of issues that behavioral health is not only existing in the Office of Behavioral Health, right? Office of Court Services, even our Judges and Lawyers Assistance Program, our OJAR, they're all dealing with behavioral health, and I serve as a resource to them. And then I do a lot of education. So if you're interested in any education, please let me know. So in addition to that kind of undercurrent, those are kind of the pillars that are always going on. There's been a couple of initiatives that have launched in the first 2 years. And the first is the one I've been hinting at, which is the Behavioral Health Committee's inaugural report and recommendations. They have been working so hard to author this report. It is set to be published in spring of 2026, so within the next couple of months. There's 4 work groups on the committee. It's education, competency, connection to treatment, and data and funding. So I think this group will really enjoy reading that report. It's a report written by judges for judges. We really wanted to start with what judges can do and need to know, but I'm confident everyone here will find something in it for yourselves in the report. The second big picture initiative is peer-led court navigation. The Office of Behavioral Health is a co-principal investigator with the Department of Mental Health and Addiction on a grant that we received. The Research Triangle Institutes applied for from the NIH, the National Institute of Health, and we received $3 million over the course of 5 years to study court navigation in 2 Indiana counties, St. Joseph County and Lake County. So this is really exciting. We're going to really have some research behind, do peers make a difference? When you put a peer in a courthouse to broker resources and provide, warm handoffs and wraparound care, do the outcomes differ than when they don't interact with a peer at all? Becky, do you want to add anything on that? Okay. So we're just getting started, so be on the lookout for that. And then the third initiative I wanted to make you all aware of is assisted outpatient treatment programs, and we're going to spend a little time diving into that one in particular. So assisted outpatient treatment, or AOT, first things first, it is a civil commitment. So as we're learning about this, that's probably one of the most important starting points. This is a civil commitment. It's an outpatient civil commitment. And the thing is, many counties are already putting people on outpatient civil commitments right now today. So that's not what's new about this initiative. What's new is the addition of this word program. So we are now standing up AOT programs. And what AOT programs do is they really put structure around an outpatient civil commitment. They make sure that the court and the treatment provider are communicating regularly and really helping people be successful on their outpatient civil commitment. And let me give you an example. In some counties and in some instances, when someone is on an outpatient civil commitment, the judge and the treatment provider might only communicate once per year. And that might be at the time of annually there's a time of review. Or if something goes really off the rails and that person has decompensated and needs court intervention, the treatment provider can ask for what's called an apprehend and return. But like I said, in some counties, that's the only time these treatment providers and these courts are communicating. An AOT program makes it so that the courts and the treatment provider are talking much more regularly. This enhanced communication is really what's at the core of an AOT program, so that we help ensure that someone does not decompensate, so they don't end up back in the criminal justice system with a new charge, so that we kind of get ahead of that and we help people succeed on their outpatient civil commitment. AOT programs are meant for a specific type of person. They're really designed for people with mental illness that struggle with treatment adherence and or repeated cycles of criminal justice involvement and hospitalization. The other piece of this is it's really best suited for those with anosognosia who don't believe that they are sick. If someone doesn't believe they have a mental illness, they probably will not want to take mental health medications, and therefore will end up in this cycle that we're talking about here. So a civil commitment is a significant liberty interest and should be reserved for those that it's most appropriate for. I won't read you this whole list, but AOT programs nationally have resulted in a number of positive outcomes. Things like shorter hospital stays, less law enforcement interaction, less new criminal cases, less apprehend and returns. But then the one I want to spend a little more time on today is an alternative to the competency process. So let's go there next. For the sake of making sure we're all on the same page, I'm going to quickly talk about how competency starts. This is a constitutional right to understand the charges that you're charged with and be able to assist in your defense. So it's a critical constitutional right that someone be competent to stand trial. Anyone, a judge, a prosecutor, a defense attorney, might question whether someone is competent. Then the judge might order a competency evaluation, and the criminal proceedings are on pause as we go through this competency process. But what happens next is, I think, what we really need to work to demystify as a state. So first of all, there's wait times for an evaluation, just to get the evaluation as to whether someone's competent or not. Then there's wait times for a state hospital bed, once someone has been deemed incompetent to stand trial. Many people who have been charged with low-level crimes spend more time incarcerated just waiting than they ever would have had they been convicted of the crime in which they are accused. For people with serious mental illness, we know all that time in custody, because often that waiting is while they're in custody. That time in custody just causes these mental health symptoms to worsen. Sometimes the sentence has been served before restoration services are complete. So someone might finally get to the state hospital, be right in the middle of restoration services, and time out. Because if they were charged with a misdemeanor, they're at the max of their sentence. Even if they are able to fully complete restoration services, they return to the local jail and often decompensate quickly. Ultimately, a lot of these individuals enter a time-served plea and are released back to the community without a connection to local resources, and quite frankly, no better off than when they started this whole process. So let's talk about the reality of a competency restoration order. First things first, mental illness does not always equal incompetent to stand trial. So someone can be, for example, experiencing auditory hallucinations and still know exactly who their attorney is and exactly what they are charged with, right? So they're not always equal. Second, and probably most important, is this green box here, and that is what a competency restoration order asks the state hospital to do. When a judge sends someone to the state hospital, they have asked the state hospital to get this person ready for trial. And I've been in a lot of communication with Katrina Norris at DMHA, and she tells me that people do worksheets at the state hospital about who the judge is, who their attorney is, and how to go to trial. As so many of you know, mental illness isn't something that goes away. It can be treated. People can have coping skills and live very successful lives with mental illness, don't get me wrong. But if courts are using this as an opportunity to completely get rid of mental illness, that's not what this is for. And then lastly, long-term management of a mental illness requires a really strong connection between a treatment provider and a court, and it will likely be a long-term relationship. So, knowing all that, this data is from DMHA, and Katrina and I have done a number of presentations together, and we know that in the last 10 years, the number of incompetent to stand trial orders have increased by 474%. That's actually an updated number from Katrina that I got recently. It costs someone to be at the state hospital for restoration services. It costs $1,000 a day at the minimum. And then this chart over here on the left tells us the types of charges that we're sending to the state hospital. The orange and the blue, so the blue is misdemeanor cases and the orange is level 6 felony cases. So if you add up misdemeanors and level 6s, you're well over half of the number of people that we're sending to the state hospital are facing these low-level charges that I was discussing earlier that oftentimes time out while receiving restoration services. So the bottom line here, and the takeaway on this slide, is that the national recommendation and my recommendation for our state is that we reserve competency restoration for those where the interest in taking someone to trial is high. They're going to learn who the judge is, how to assist their attorney, what they're charged with. So we really should flip these numbers on their head. So back to AOT programs. AOT programs serve as a possible alternative to competency restoration proceedings because remember, AOT programs focus on getting someone, getting their mental health managed, making sure they're taking their medications as prescribed, seeing their treatment provider regularly, and living successfully in the community. We had 3 AOT programs in the state before the Office of Behavioral Health was even created, but 7 more have been invited to participate in what we're calling the AOT program pilot cohort. So you can see a list of all those counties. The top 3 are the ones that already existed, and then the 7 additional are there. The AOT program pilot cohort had a big kickoff in October. Many of you were there, and I appreciate your partnership. And then the cohort has received monthly assistance from myself and the Treatment Advocacy Center since then, and will continue to. Important to note, the 7 are not stood up yet. They are in the process of standing up their programs, so more to come as they stand up their programs. I did want to quickly mention AOT programs are only one alternative to competency. There are others, and one that's important to quickly mention is just voluntary treatment. AOT programs are on one end of the spectrum in terms of the liberty interest. Voluntary treatment also needs to be considered, and that would be the other end of the spectrum. And then there are other possible solutions to the competency crisis besides just exploring these alternatives. And that behavioral health report I mentioned has a competency work group. And the competency work group is going to lay out a lot of those recommendations beyond just AOT programs, things like competency dockets, dashboards, a directory of available evaluators, outpatient restoration, jail-based restoration, and even some states have gone as far as to enact legislation that says we just simply don't send misdemeanor cases to the state hospital. We don't have that currently in this state. So again, I invite you to read that Behavioral Health Committee report. Looking ahead, additional counties will be accepted to the cohort. I had lots of counties who were interested but wanted to be sure that I really supported the ones that were accepted the right way. So it's not an if, it's a when we add additional counties. DMHA has received mental health block grant funds to support this initiative, and we are working on brainstorming how to best utilize those funds, so more to come on that. And data will be collected and outcomes will be measured to really inform where this initiative goes from here. I will wrap up with questions and just generally how can the office support you all. Thank you.
Well, thank you, Brittany. Do members have any questions for Brittany? It was a lot, but she's done a lot.
I do.
And yeah, please, Ashley.
Brittany, I appreciate this, and it speaks to a lot of what rural counties are dealing with. I can 100% guarantee that all of our competencies that are being set and requesting for restoration, they're all misdemeanor, low-level felonies. But we're in a cycle of if they aren't going away to the state hospital, they're not getting stable enough to even have conversations, and they're all in this state. You know, we have the ones that recycle in and out, but even working really closely with our community mental health provider, if we have an individual who just refuses treatment or any kind of medication, getting them on the outside, what are our options?
Mm-hmm. So thank you. That's the exact scenario where AOT programs come into play. Because remember, with an AOT program, they do go to the state hospital. They just go to the state hospital under a civil commitment as opposed to competency restoration. With competency restoration, the focus is this person's going to trial, let's get them ready for trial. With a civil commitment, the focus is let's stabilize the mental illness. And then what happens is the person would step down from the state hospital to an outpatient, it's called outpatient status. It happens administratively on DMHA's end, and that's when an AOT program would become a really valuable tool, because this person will ultimately come back to our community, and the AOT programs provide the tools to make sure that the treatment provider and the courts are working together to manage that.
So I think, at least in our community, I know that the struggle has been how to get the civil commitments processed. That is where our system buckles, because if this individual is homeless and has no support and isn't connected to a provider, how does that all start? And so I don't need you to go into that now. I know that's a long question, but so my suggestion would be really working on getting that information about civil commitments and how they actually process through the system, who's responsible for each part and all of those things to the local communities so that they can be used. I think everybody would love to use them. I think we're getting tripped up on how and the semantics of the system.
Sure. Thank you for that. Yeah.
You know, Ashley, I'm really glad that you're engaged in this, and for anybody who couldn't hear, or anybody online who couldn't hear, Steve and I had a sidebar during this, and I want to just say what we talked about is that we're going to present, Brittany and her office are going to present on AOT to the Sheriff's Association's annual meeting on Tuesday. One of the things you'll be able to do is reach out to your sheriff and say, hey, you heard this presentation. Are you interested in standing up an AOT program in our county? And what I think that we can do, I've been invited to take part in that conversation to just explain to the sheriffs, this is what you can use your local JRAC for. So if you actually wanted to have a sort of a holistic conversation in your community about how to best manage your scarce resources, your scarce behavioral health resources, and align them with the capacity that the state has, we can come in and help you have that conversation. That's one of the things I want Chris to be able to work with CEPP and Brittany's office on, to really tailor our technical assistance to meet the needs of the community. And then the other thing, and this is why especially for you members that are here, I really want you to, if you take the time, go back and read that report that Brittany had. And if I could just bring you back in time to 2022, when we rolled out local JRAC, some of you might have attended our big 2022 summit. And the purpose of that summit was to introduce all our local JRAC teams to the concept of local JRAC And we overlaid a substantive issue on that, and that was implementation of 988, which really was again designed to just, this is the way you're going to have all of these folks with behavioral health issues that get court involved, justice involved. And the reason that they do is because most communities only have a law enforcement response. These rural communities like you're serving in, like I used to serve in, the police get called, they end up in jail. But what we want to be able to do is for those people that really, truly would have more benefit from being connected to meaningful treatment and thereby preserve your scarce jail space for violent criminals, you want to be able to have a different path to connect them to. And so that's really what I wanted to share with Steve. I was particularly excited about this. I want to preview him that we want to go over and let the sheriffs know that this is something that we're trying to make available, because at the front end, there's a real bottleneck. I mean, in my jail, if somebody came with a serious behavioral health issue, they might get put in a segregation unit because there wasn't a proper place. They might have scarce staff, and then there's really, that's exacerbated. But it's also at the executive branch. I mean, Becky, Doug, you know this, and Danny, I'm sure, is the governor's designee that's on the call. We have just this scarce, finite amount of bed space that's available to deal with competency restoration. They're not making the folks better. They're just preparing people to go to trial. So what we really want to do is make better use of that bed space to actually treat the folks with a serious mental illness so we can get a better outcome. Now, there will still be folks that need competency restoration services, but as Brittany indicates, we really want to think that should be, with scarcity in mind, because we all operate in scarcity, reserved for those folks who are likely to go to trial. And the other folks, we really want to use our most intense services, because they are expensive, better and more effectively to make sure that we're actually providing treatment. So super excited that Brittany's able to do this. Structurally, this is hard to do. And the reason it's hard is, again, because we have these 91 county-based systems. County's expense is like 70% of their budget. Is that right, David? Goes to the justice system. So it's a big expense. Their budgets are going to be even more crunched. But the executive branch is really in a pickle with this too, because again of these bottlenecks. So it's just incumbent upon all of us to be able to navigate this a little bit better, and we have to lead the charge on that, because that's really our statutory obligation. So thank you for being here. Thank you for being engaged. But we're going to hook you guys up if you want it.
Well, and I would like to give a shout out to the CCBHCs and Centerstone and our community mental health. Like the work that they've been doing has been tremendous in the last couple of years in our community. It's really made a lot of differences. But even with everybody at the table, even with the crisis intervention team, with our law enforcement, even with all of these pieces, we still get stuck when they get into the court system. And that is where we're having trouble. So I think the AOT program sounds amazing, and I just can't wait for all that to kind of get all the way across and get into the systems that they need to have. So, thank you.
Please, Becky, yeah.
Yeah, so I really appreciate the partnership with Brittany. And, you know, as we know, this is a very complex, challenging issue that needs multi-pronged approach, right? And just to put some numbers behind what you were just speaking to, 70% of the individuals in our state hospitals are there for competency restoration. And so when you think about the other folks that really need access to that mental health, that, you know, very high level of mental health treatment, mental health intervention, they're not getting it because there is that 70%. And so while we are very excited about AOT and the expansion of that, we've also had some conversations more immediately with some of our community mental health centers and recognize that we need an answer tomorrow, right? And so we are pulling together a very small group because we also recognize that there are some contractual, logistical challenges in order to do jail-based competency restoration. What does that look like? We have to contract with folks and these kinds of pieces that we haven't always understood all the nuances that need to happen in order to make that jail-based competency take place. And so we are going to start meeting with some of our community mental health centers to look at how do we address this immediately while we're building these AOT programs for longer term. And then I'm glad you mentioned the CCBHC, because I think the other piece that doesn't get talked about as much is the evidence-based practices that are going to be provided through our CCBHCs, such as Assertive Community Treatment Act. And we can look back on when the ACT programs in our state, when they started to dwindle, and you can see the trajectory of individuals coming into our state hospital. And so while ACT is an evidence-based practice for folks with a serious mental illness, I would advocate we need to market it as a way to prevent competency restoration needing to happen, way to prevent interaction with the Justice Department. So thinking of it as a treatment for severe mental illness, at the same time a prevention from coming in contact with the justice system. And how do we start marketing it that way so that folks start to see the benefit of the program itself, and allow for more expansion of those initiatives. So very excited about the opportunity. You're going to get an invite for that, Brittany. We definitely want you to be there for that as well.
Here too. Please, Steve, yes.
So, obviously, this is great, exciting. We've talked about it. But I guess my question, I don't know. I mean, I know it's a pilot. I heard what Becky just said. We need to move immediately, which I know we do. And I hear Mitch talking about state hospitals all the time. Are we looking at, does it require legislative change? Are we looking at some kind of big legislative effort? Are we looking at the next budget cycle? Do we know the answer to that question?
That is some of what we are hoping to figure out in the next couple of weeks. Because if it does require us to have a contract with our community mental health centers to do jail-based, is that necessary? But that's in code. And so are there minor tweaks we can make that don't change the spirit or the context, but just allow for reduction of some barriers? So I hope to have more of those answers. I don't know if Brittany knows some of that already, but we hope to have more of those answers for you very soon.
Okay.
I would just add that, I can tell you more about what other states have done legislatively that could give us a really good roadmap. In the behavioral health report, and I'm happy to share it before this comes out, but in the behavioral health committee report, you'll see that the National Association of Defense Lawyers, Criminal Defense Lawyers, I think it's DEL. Thank you. They put together a resource, a state-by-state resource of state laws around competency. And they're wide and they're varied. I mentioned no competency on misdemeanors as in some states. There's an option to say at the time that we do a physician does a competency eval, maybe they also opine on whether this person's appropriate for civil commitment. Maybe we could put some stopping points where we evaluate alternatives. There's lots of options, and we have other states to look to as to what's worked well. So I think more to come is the answer.
One of the question about legislation comes up, and I would just sort of challenge members to think about holistically all of the structural challenges in our system, just how difficult it is to get all of our constituencies to understand even just 30,000 feet what it is we're trying to do. What we're really trying to do is just make sure that there's bare minimum enough to meet public safety, the treatment needs in these communities that have shrinking tax bases, shrinking funding streams, and our executive branch is the big state-funded thing we all share. So when you have that shrinking stream, there's a tremendous incentive for our local stakeholders to say, let's just get them out. Let's get them into the big state-paid system. And you can't blame them for that because they don't have enough local resources. But we can't ignore that either. So what this allows us to do is actually communicate as effectively as we can what the problem is. It's always operating in scarcity, and we make sure that we have the appropriate intervention regardless of what the issue is. So I think that requires uniformity. That's what the legislature has given us with the local JRAC statutes. All of us need to be just doubling down, and you got to participate in those conversations. But with respect to legislation, I am really grateful. I think we've had increasing participation from the General Assembly in the last couple of years. We've had some I mean, they passed local JRAC statute, but we've had some other issues. I would like us to be spending some real serious time as a group coming together and identifying legislative priorities that come up. This was created by our by our legislature to do that. I mean, we're supposed to be the ones. It followed comprehensive criminal justice reform 10 years ago, where they took a whole bunch of people, really these folks. That's why it's important to understand that the behavioral health challenge, that's who they were trying to get out of the DOC. Those are the folks with substance use disorder, but they fell onto this really poorly resourced network of community behavioral health centers that was never adequate to meet that need. So we understand that now, and what we need to do is just really be efficient. There's always going to have to be some tweaks in the code, but we have their attention, and we have their confidence, we have their participation. So that's really what I think is important. And because it is so complex, and we all share that responsibility, and I talk about that a lot. We share the responsibility because you think about if these folks in past times were all under one roof, they were all the responsibility of a single institution. Now, in order to provide adequate public safety and treatment, we all bear some responsibility in ensuring that happens. So that makes it critically important for us as a body to be effective communicators with each other and with our constituencies. And I think that's exactly right, Steve, but I think that we probably ought to be coming together on a regular basis to look at those things and identify them so that we're not working against each other when we get into a really compressed legislative session and our partners are really trying to deal with a lot of things with inadequate time to consider them.
Just as a follow-up, I want to raise the visibility. We still have a week. I suspect if you ask one of our legislative members to introduce a resolution next week to assign to JRAC, taking a look and come back with recommendations that go to Legislative Council, and it'd be something that would elevate this topic coming from JRAC for the next long session.
You go ahead.
Agree with what Steve just said, and then I'd like to follow up on the comments, Justice, that you made. Agree with everything that's been said. Brittany is such a tremendous resource. She's provided training to IPDC since she's been here. And so, on the PD side, we really have been working to try to bring folks along and educate. It's a long road. And so this is a great conversation, but I really want to come back and amen what Becky said. She said it so graciously and nicely. Any space where we can lean into prevention to keep people out of the system, my goodness, that would be huge for all systems, for all of us, and to minimize sufferings. I just wanted to highlight and amen that any space we could lean into prevention so people are not coming into the system would be huge. So thank you for bringing that up, Becky.
If I can add, I got a lot of thoughts about this, and probably if you guys want to stay here till about 2 o'clock, we're dealing with the Senate Bill 285, which is going to address homelessness and encampments. And there's been a Supreme Court decision, grants past decision, that kind of creates standards, addresses the problems. But I believe if the conversation we're having, if the legislators had this information, which I'm sure some of them do, but to everybody's point is getting them involved to what is going on here would prevent Senate Bill 285. Because I feel like the great work behavioral health the courts are doing, you pass a bill like 285, it's just going to put you back a little further now. And you guys have moved so far. And then because they probably are not in the loop here, this bill comes out, and we still have time. We're going to address it and try and get it slowed down. But one of the things I was thinking about this morning, and I don't know, and to the chair here, I don't know how many times we've only a couple written recommendations to legislators about not doing things. There's still time before the session closes. I would love to have a letter about this and how you guys are creating a solution. 285 is about connecting the homeless person to services in jail. I don't know how that is, other than I can guarantee they're going to be connected to probation. That's about the only service. Because there's people not going to be coming there the next morning lined up for social workers and the people that need to see to talk to this person. It just doesn't happen. It comes through a process. So I hate to see legislation passed that's going to slow down the great work you have done, and I see that happening. So, you know, again, the AOT program, I've taken a lot of time to understand it and really getting the sheriffs to support this, because I think they can find those individuals in the jail that don't need to be there and say, hey, let's put this person in AOT. And that's where I'm compassionate. The human factor comes in, is stuff like that. And again, I don't know how everybody feels, but that's my ask. And if we don't get anything done, a letter in the next few days, I get it. But 285 is going to impact, and I think slow down the work that strategically, the way you've built this, that's how I would approach a 285 bill, is let's attack it from all angles. That's what we're not doing. And it's going to take time. You got to have a 3 to 5 year plan. In my head, I've already gone through budget session next year, short session the following, then 2 years of a budget session. I'm like, we can get this done in 5 years. It'll take time, but at least we're addressing the problem. And right now, we've done so much work the last couple of years, and yes, there was change of administration. Things have slowed down. And there's a lot of great product on the shelf right now that I don't feel like it's getting implemented. And we are the group, I think, that can champion that. So that's just me talking as Steve Luce, but as the executive director, I believe that in the sheriffs that Senate Bill 285 is wrong. It does not connect these individuals to services the way they should. It does address some of the issues. One of the biggest issues is, what do I do with all their property? You know, the jails are not going to be able to take on the property of these individuals, and they have a right to keep that property, even though they're homeless. So I think the bill was not thought out very well. I think it was pushed from outside organizations. And us here in Indiana, we need to use the resources we have, because we have a lot of great people here, and I think could work with the legislatures. Even if it's mandatory, they meet with the Office of Behavioral Health to see what's going on annually if they're on the criminal justice committees. That they should know, and that's how we make things happen. So that's all I got to say. Thank you.
Well, no, thank you, Steve. And I think that that's another way to think about what I was trying to articulate. It's probably a better way. And Bernice, picking up on Becky's point, you know, if you read that report that came out from the National Center, it talks about an intercept zero in every community. And so having an intercept zero is really that pre-law enforcement intervention that prevents folks from getting into the system to begin with. Because once they get into the system, there is a transactional cost in getting them out of the system, even if they're there. But the other thing is that, yeah, the process right now for our legislative partners is so quick that my thought is that because we have so many delicate relationships and such a complex structure that we need to tie together, I wish that we were relied upon more and maybe systemically, so that when there is some legislation that's being considered that's going to have an impact on our local stakeholders, that this should be a body that should deliberate about it and give some recommendations for their consideration. There will be emergencies that will come up, but I would just argue that this is a statutorily constructed body that represents the professional organizations of every important criminal justice stakeholder in the state. This is a place that could deliberate and give them really good output. And you know, the other thing to think about is, I don't know what kind of power might be brought to bear in a crunch on some folks, but because, you know, you all represent sheriffs, because you all represent county council, county commissioners, because you all represent, you know, elected prosecutors, all the important treatment providers, that is an important source of power, and it represents the will of the people, the communities that are represented. A lot of people are elected stakeholders, so it's just an important constituency, a group of constituencies that are not only well informed, but they represent, you know, 7 million about Hoosiers who have entrusted their public safety to them. So this is just a way that I think that we could be much better partners with the General Assembly if we could build in a better way for them to hear it. So whether it's a singular resolution or more comprehensive resolution, that I think that is a good idea, and I think that it's something that conceptually, in the crunch, I don't know, we have time to, in fairness, we probably should get feedback from everybody we go through and do that, but I think that that's something that we really need to do, and I view it as somewhat urgent just because of all of the cost considerations that are hitting our county-based systems now, as much as any time during my 30 years in career. So.
If I can just add, the one slide that hit home with me was that correction institutions are de facto mental health providers. And
Yeah.
that's what we want to prevent. And I even went back to a report that Justice Goff gave to this committee probably 3 or 4 years ago when he was on the National Courts Behavioral Commission. And it talked about the jails should not become the mental health hospitals. A lot of great information when I
Yeah.
went back over that stuff. So.
Well, I'm a one-trick pony, Steve. I mean, we talk about this the whole time, but
Yeah.
that really is what it is that we're your guys are the triage, and
Yeah.
they've got a lot on their plates, and so that's absolutely a valid point. It's just reality. They face the brunt of this.
I think the problem with that is jails are not meant to be mental health providers. So jails are having contracts with service providers for
Yeah.
mental health and medical, services that are tailored to a jail setting. They're not tailored or set up in a way to benefit individuals who are suffering with mental illness. That is secondary or even 5 or 6 down the line on the priority of those contracts. The purpose of those contracts are to make sure that people are taken care of medically and receive enough to maintain them along with the correctional staff and make sure everyone's safe. And that is not how we get mental health individuals who are suffering with illnesses stable or in a space where they can even begin to come out of the system in a better place.
To Ashley's point, the sheriff does have the duty of care. And
Yeah.
if that duty of care is going backwards, all he or she has to do is maintain their health. But if they go below that, they're not doing their job. And that's where I see us having issues.
I think the important thing is that you are finding ways to create and incentivize diversion opportunities from the system, and that may be AOT, it may be mental health courts, but you don't have to go through the competency process if you're diverting, right? I mean, if your agreement is that you're going to go do this in lieu of having a trial or being involved in the criminal justice process, the competency process, everything that Brittany said about that is 100% true. It's really expensive. The other thing I don't think maybe was not specifically mentioned is that contracting with someone to do that competency evaluation is really expensive, and there's very few providers that do it. And as a result, supply and demand, they charge a lot of money. That comes out of the county coffers, and those are resources that could be used in a different way if you were going down the diversion path. And so creating and incentivizing ways to use diversion, I think, are really important. Then the other thing on Justice Goff's big picture suggestion, I want to make a suggestion on that, which is that, and it's too late for this session, but I think what a lot of us do at the beginning of the session is we take a look at proposed legislation and decide sort of how we're going to respond to that legislation. And then we have individual conversations amongst us, Bernice, Chris, Ashley, Dave. I mean, I think I've talked to a bunch of people about certain proposed legislation throughout the session. Maybe perhaps as JRAC, we should, at the beginning of a session, the next section, make a point of make sure that we're getting together and talking about some legislation that's on the table so that we can respond to it in a more collective fashion rather than in a piecemeal fashion.
Well said.
Justice Goff.
Yeah, please, Bernice.
I'm kind of jumping ahead on the agenda, but to come back to what Judge Spitzer just said, I agree with what you said, but I would like to add, I think it would be really nice to start using the Criminal Code Reform Evaluation Report as the collective tool we all work off of. So there's going to be a world where IPDC is going to want legislation that you all won't care about, or one way or the other. But my goodness, like this report, when you go through it and you see all the things that we're concerned about in common, if we could come together and go, here's the data, this is the information, this is counter to what we want to see happening, what can we as a, table come together and push as one voice that would help. So agree with what you said, Judge, and I was going to say the very same thing about adding this tool, that we should be using it and not just shelving, it's sitting on a shelf.
Doug, before we close out our report out from Brittany, we're going to turn to you and Maddie for the report on that, but it strikes me as a pretty good idea. I mean, that's the official voice, but would your organization, I mean, it's still a new role, right? I mean, becoming well, and you get to working with folks long enough, you kind of understand. These are some of the same conversations. I would just say, for the benefit of everybody here who doesn't know, Doug's been with this conversation since 2019 when we first started working with the National Center to kind of roll out some of these things. And so when we were thinking about the summit, we were thinking about that. Doug was present for all of those conversations. He's in a different role now with the new administration, but I we haven't had a conversation like this, but that strikes me a good idea. I mean, would you all be open to having more frequent discussions? Maybe have a work group or something like that to provide a space for those conversations?
Yeah, so after Maddie presents the current report, one of the things we want to talk about is what are we doing next? I think the statute leaves a lot of room for us to provide more useful analysis and more relevant analysis. And one of the things that we're working to do at the Institute is to realign what we're working on with not just our priorities, but also the larger priorities of the justice system, which largely is here at JRAC. So we've already worked to do this a little bit just with YJOC funding that we administered in the juvenile justice system. Maddie's team has already gotten a federal grant that will cover the analysis of the data that we're collecting. And so why not have somebody else pay for our work? It'll leave more money to go into programming. And so that alignment is what we're looking to do with this report. How can we provide something that is not just a useful analysis, but also relevant and in a format that is helpful for all of us as well.
A lot of interest, so I knew it'd be worth their while. Thank you, Brittany. Any other questions? Notwithstanding the lively discussion, we are still at a point, I think, where we could, we're going to hear the report from CJI, but we take about a 5-minute break, and then everybody, we resume. We're on track. We're going to be back on quarter after. So, and we'll hear from CJI. to go ahead and call us back to order. I appreciate everyone's patience. Brittany, thank you again for your time and all the hard work that you and your partners are doing in the Office of Behavioral Health. Obviously, there's a lot of interest in the subject, and have confidence we're going to be able to help a lot of our constituents in addressing their community's needs, so thank you. Now turn to our second presentation. Everyone's looking forward to hearing from the CJI, and turn it over to Maddie Knight, who is joining us from the Criminal Justice Institute to present the council with the 2025 Criminal Code Reform Evaluation Report, which was also included in your pre-meeting materials. So, Maddie, thank you for joining us today.
Yeah, thanks for having me. So today's presentation will be fairly broad because I'm more so interested in how we can improve the report moving forward. So, Bernice, I'm really glad that you set the stage for that. Thank you. I first wanted to introduce myself. So my name is Maddie Knight. I am now the Director of Research at ICJI. Prior to this, I was working on a BJA grant helping jails to implement MOUD. So very passionate about the treatment landscape in jail settings. Prior to that, I worked at FSSA as the science officer, so managing our state-university partnership and research efforts there. I did want to call out a long-standing partnership that I also have with Dr. Brad Ray, who presented at the last meeting, and also is involved with the peer-led navigation project. So I was curious, Brittany, if y'all are going to look at the people who are connected with peers in the court and the AOT program, if there will be any sort of overlap.
AOT is not included in the grant we have with RTI and Brad. So not at this time, but I think we could explore that.
Might be interesting. Like, I perked up when I was like, oh, Lake and St. Joseph are in both. That's interesting. So this annual report is submitted to the legislature at the end of the year. This is submitted in partnership with JRAC. So I do want to thank you, Justice Goff and Jenny Bauer, for your contributions to this report. So just some general updates that we did. We wanted to make sure this was more functional and hopefully more accessible for folks to actually read this. So it's my understanding that this has been a pretty lengthy report in the past, and maybe folks don't read through every portion of it. So we did trim it down from 90 pages to 67, so it's still quite lengthy, but we tried to make it more concise and appropriate for legislators to read. So each section on the introductory page links directly to that topic. So if you click the tile, you can get taken directly to the section that it applies to. We also updated our glossary of terms as it was a bit outdated and some of the terms weren't necessarily relevant to the report. Previously too, the recommendation section was at the very end, right before the conclusion. In my opinion, that's probably the most important part of the report, so let's put it at the beginning. And again, I think the recommendations I'll share today, we can probably make some improvements in the future and make them a more partnered approach. I do want to acknowledge that many of the partners here today contributed data for this report, so I won't go through it all, but I do want to acknowledge those contributions. So some of the recommendations, and I just want to highlight one key finding for this group in particular. We can see over the past 5 years that the most common felony filings were related to substance use. So that could be something such as operating while intoxicated, possession of a syringe, possession of illicit drugs. And for this past state fiscal year, about half, or 44% of individuals that were enrolled in community supervision with a felony filing had a charge related to substances. So that's pretty significant. Less than half of those individuals who were on community supervision successfully completed their program. So 46% of offenders completed their sentence. So I think this group in particular could think of some opportunities to improve those outcomes for individuals with substance use needs. So the first recommendation we have here is investing in evidence-based mental health and substance use programs. Brittany, I think you clearly laid out why that's important here. I also wanted to call out that the Trump administration put out some recommendations on their drug policy priorities, and medication for opioid use disorder or medication-assisted treatment was highlighted specifically in jails. So I think that's a great opportunity for us. The second recommendation is to improve Indiana's justice data ecosystem by supporting in-jail. The courts have been doing some great work with in-jail, and I had a demo from the courts. There's some incredible work that can be done with the data collected there. Things such as what medications people are receiving in custody, even results from screening tools, as well as you can see what items people leave custody with, including medication. So I think that could be really interesting to incorporate into next year's report. Additionally, increase resources for crisis response systems. This clearly reduces burden for law enforcement, but also assists with those diversion strategies, connecting individuals with urgent mental health needs to services. Address staffing shortages. I think that's a recommendation by nearly any group, anytime. We can't provide good services if we don't have people in the right places. And then particularly for this group, providing technical assistance and funding opportunities to the local JRACs. So, Chris, I would be really interested to see your survey results and how we can partner together to make sure local JRACs are getting the help that they need. All right, so for future reports, I think we can generally open up the conversation. It's my understanding that in the past this has been more of a data exchange than it has been a partnership, so I would like to highlight that we're interested moving forward and working together with these groups more. Joint recommendations, so I think making sure that this group is invested in each of the recommendations that we put in the report. There were some dashboards on our website that highlighted some of the data here. They were static, so they were updated once a year. They were using data that was not ICJI's data. So I don't know how much the other groups that did have data highlighted here were involved. We've since taken them off the website, so they're no longer accessible. But if that's something that this group is interested in revamping, that's something that we can discuss too. So that's really all I have for today, but I would love to hear any recommendations, thoughts for future reports, and if anybody read all 67 pages, thanks.
Maddie, thank you. What a wonderful report, and I love the concepts. Doug had me at alignment, which Brittany will tell you is a word I throw out all the time when I'm thinking about this work, because the answer to those structural complexities really is alignment. And when I think about our work, we're not only having to align with our local stakeholders, which is complex, but especially the executive branch is needing to align with what's ever being rolled out by the federal government. And one of the things that makes it so complex is many of the justice involved folks end up in the courts. And so if there's not alignment between the courts and the executive branch, there's so much room for inefficiency and all of the related problems. We're doing a lot of work right now with judicial resources to try and align ourselves, which is its own set of challenges with a non-unified system. We don't share a budget, we don't share an administrative structure with the trial courts. So I talk about alignment all the time, but I guess that's my question is that do we need to take some sort of the legislative idea, I think, is tremendously important, because that's how we align with the first branch of government. But do we need to do some work internally with our group to align better so that we're coordinated with our deadlines? And if you have any suggestions about that, I'd love to hear them. And we want to partner.
I mean, previously, I think this was started pretty late in the year, and the data work was done, the report was put together. So I think making this a longer term process is a great start in the right direction.
And I think while this is a statutory requirement that we produce a report, I detest the idea that we just create paper. And these recommendations, while great and needed, I think where we could have some better alignment is really around what do those recommendations mean, and what are the action steps that we can take now that maybe we need the legislature's help on, and then what are some long-term things that we haven't quite found agreement on. We all agree that they are the problem, but perhaps maybe we around the room don't fully agree on solutions that we keep working on. And so, because I think broadly, I think for the last many years, these recommendations would be in our top 10. And so I do think that putting more meat around that and having a process where we work on some implementation or provide more guidance to those who do implement things, I think would be very helpful.
Yeah, please.
So I don't, it's interesting, Bernice talked about maybe using this as a template for, identifying some things moving forward, and I had the exact same thought, and there were some things that struck me on the report that I made note of. I think maybe one thing, Maddie, where it's available that would be interesting is a frame of reference and some comparative data. So how do we rank on a national average? And so when we look at locally, we were looking at, for example, how's our probation and court supervision doing. We look at sort of national averages for things like revocations, technicals, and things like that. We're way, if the numbers that I'm looking at, we're way below national averages on some things with regards to supervision, outcomes, and things like that as a state. And so how do we, and part of that, as judges, we own some of that, in terms of how we respond to violations. And so certainly take that on. So maybe looking at that. The recidivism measure in the report too looks great, 36.5%, but that's a DOC recidivism measure, and it's recommitment within 3 years to DOC. And so when we think about if someone is released from DOC, and then in order to count as a recidivist, they have to be back committed to DOC within 3 years. Well, there's a lot of criminal activity that happens within that. Locally, we use arrests, which a little bit overcounts recidivism, because you can have civil arrests and things like that. You can have arrests that aren't adjudicated for one reason or another, but it's a much better measure of recidivism. So if we're going to look at recidivism, at the least we would need to stretch out that recommitment period if we're going to use that. And then if we want to use something else, arrests is a much better measure. And let's face it, recidivism is the coin of the realm here. I mean, if we are doing a good job as a system, we're one and done. Every time that we commit somebody to a prison or something like that, let's face it, we're sending them to boarding school for criming, is what we're doing. And they're learning criming 101 in the jail, and then they go to RDC and they get criming 201. Then they go to the prison, they get criming 301. Pretty soon they've got a doctorate in criming. And then, an alarming thing that I saw in the stats too is us as judges are sending people to DOC with nothing else on the back end, or to jail with nothing else on the back end. So we send them to criming school, and they come out, and we're not doing anything about that. And so we've created better criminals. And so, looking at sort of that step-down process, reentry court, CTP, step-down probation, things like that, where we can, when they come back from criming school, we kind of deprogram that, and we get them ready to. We also help them get a job. We help them get housing. We address their behavioral health needs on the back end too. And then we do a lot better on that recidivism number. So I think maybe looking at some of those measures, how are we doing as a state? Where are we falling down? How can we implement some things that would be much more effective at addressing the recidivism number? So my thoughts.
Already hit on some of the things I was going to say, but first of all, welcome. Yes, I read. And I'll email you. I'm not gonna, but just here's some high level things I just wanted to share with the group. On page 9 in the recommendations, I think as we are at this table, I think it's so important to be mindful that not all of us knows everybody else's discipline. So like looking at recommendation number 1, I love it, but just through some research and convention things I've been to, I know that some states have filed a 1115 Medicaid waiver. I don't know anything about that. I do public defense and training, but I've learned that some states are using this waiver as a way to provide and use federal dollars for, services in jail, pre-release, etc. I don't know as I sit here what Indiana is doing on that front. So I highlight this as saying, can we bring that conversation to this table so that we as stakeholders can go, are we taking advantage of this opportunity? What can we be doing to leverage that? I brought up before, we've discussed like using this tool for legislation. I agree, I think maybe Doug was going there, but this also can be used to train us. I was looking at page 11, and on placements, it says DOC was the most common sentence type at 21.5%. What I took away from that is, why are judges feeling like they have to do that? This could be an internal training for us. We don't need the General Assembly. Let's get together. Can we look at counties where that's true? Can we take to the local JRAC? Like, hey, do you know that here's some other ways that you can sentence and bring in reform and things of that nature. So it can be an internal focus to us too. Then in terms of legislation, I just wanted to highlight one thing that is like another example. 285 is one example. Here's a second that, like when I read it, it just makes my stomach twist in terms of being contradictory to what this table's trying to do. If you look at House Bill 1258, it is going to, and it's moving, it's going to pass. But it's changing the definition of what it is to be a crime of violence. In some ways, it's very helpful. It's cleaning up the statute. But the change that's happening that's really going to impact the system is that it is going to add level 6 battery and level 6 resisting law enforcement to a crime of violence. That's a big system impact. Numerically, those are very high charges. It's easy to charge a level 6 battery and resisting law enforcement. Easy peasy. What that means is to the system is that once someone's convicted of a crime of violence, that can be an aggravator. That means a longer sentence. Look at this report where it talks about the number of level 6s in DOC. We have just created potential, if it's an aggravator, for a person now with a level 6 to be sentenced to DOC. I mean, it's just really tremendous. And when you look at the bill, you might worry, oh my goodness, if it's a crime of violence, there were changes last session about bail. Like if a person is a violent arrestee, now it has to be an individual setting by a judge before a person can receive bail. The bill doesn't impact that. It actually amends that section of last year's 324 that a level 6 battery person can still be set by like a bond schedule or something like that. But I just wanted to point out that this tiny little change that might seem innocuous it's a ripple effect throughout the whole system. It's a ripple effect to DOC. It's a ripple effect to community corrections, because a person supervised who's a violent arrestee, now maybe a level 6 battery conviction, the standards of supervising them is different. So this is an example of why this tool from CJI really can be helpful to educate legislators on the impact to the system. The last thing I do want to add, and I'm going to email you my thoughts, is the jail overcrowding data. And I love the way you've organized the report. It's beautiful and very helpful. In reports past, we got the actual names of jails that were overcrowded. It's not in this report. I want to share how I use that data, or I think we could use the data. When we see like counties that have jails overcrowded, to me, that's a sign we need to lean into those counties. We need to lean in and say, hey, local JRAC, we see that this is a challenge. Here's some options that you have to use your resource differently and more effectively for public safety. So to me, like seeing those, it's helpful. I just wanted to offer that. But I'll send you an email on my thoughts. Thank you for everything. This is a great report. Oh, you did a great job.
It was interesting, but I really appreciate too your comment that, I think there was some maybe intention in the past not to step on toes or say things that would upset others, but that doesn't always get things done. So
Right.
I appreciate your comment.
And understand if you can't, but if there is space where JRAC could, it's like these are the counties, and then we deliberately reach out with support, not harm or shaming, but like help.
Appreciate it.
Yeah, Ashley, and then Brittany, please.
I just want to say you guys did a great job. I love all the changes. I did not read last year's report because it was 91 pages, and I looked through it and couldn't see anything that stuck out to me that really caught my attention and my time enough. I love the recommendations are up front. I love how they're very prominent. I love the highlighted pieces in each section. And I also really enjoy the trending of the 5 years. I think that's so important because so many times we get reports that show, hey, here's the numbers, and there's no reference, there's no context, there's no there's no bigger picture of are we progressing or are we going backwards. And I did not read all 67 pages, but I did skim through it and I did find it very helpful and a lot of really good information. And I do think that we could utilize this not just here at the state, but at our local levels in a way to make real impactful change. So thank you.
Thanks for the feedback.
I agree. I love it. I just wanted to echo 2 things. One, I think the action items are a great idea. Specifically, who's already working on some of these things, I think could be built into an action item. And then where can we go next? And that might require a little more work on your end to have those conversations with these organizations, on the front end. But I think it would be a really good way to show what everyone's doing as opposed to possibly siloing us further. And then just to echo, I love the idea of local JRAC training specifically on this. So I don't know if that's been done in the past, but I mean, you could offer one webinar even and invite all of, if you're thinking about staffing resources, you could offer one webinar, invite all local JRACs to hear it all at once if you wanted.
That speaks more to my thinking about the whole sort of global picture is, I think Bernice's point about educating the locals is important, but I think that what we would need to do, and really what my thoughts about this whole concept, when I talked to Chris Bean, I mentioned the idea of sort of more generic or more discretion with respect to grant funding. Our technical assistance should be fairly uniform. You can base a discussion with all these multidisciplinary local groups around our tools like the sequential intercept model, like system mapping, and you can overlay those templates with whatever you want to talk about specifically or just generally. But what I think is really important for our local stakeholders to understand is, what is the state's capacity? If Becky's office comes over to Brittany's training a few months ago and just really illustrated This is a finite number of beds that are available, and 70% of them are used for something that's not particularly productive. I can imagine that would be maddening for an administrator. The problem is there's no mechanism by which we can say right now, you shall not do that, because we have a non-unified system. So we're always stuck in this perpetual, tug of war with, this is a really good idea, you ought to do it. And if somebody wants to be a stick in the mud and they say no, well, I guess you've got the power there locally to do that. But what will happen is, if we have that uniform training, where we can go in and tell all different stakeholder groups at the same time, this is the state's capacity. If you want to have access to it, as a practical matter, you really need to be using these local interventions so that you're putting the right people in. And then we can say to the state, you really do need to be funding this much, because that's what the need is, not after we've used all these interventions. But the other thing this will do is, that will shine a light. I mean, there's a lot of people collecting data now on those communities that are, for whatever reason, reluctant to embrace the evidence-based practices. And then we're in a much better position to go and say, this is where the need to incorporate those practices actually is. And I always thought, we can go in with a multidisciplinary team. It doesn't have to be IOCS necessarily, and say, we can help you with this. The numbers indicate this is something that needs improvement. Doesn't have to be an adversarial position at all. It can just be, we're all trying to provide essential public safety resources. This is how we can partner with you as a state organization that's composed of all these different stakeholder groups and professional organizations. So I just think helping everybody understand, and that was the purpose of that 2022 summit. We brought together all those local members to communicate to them, we're trying to do something big as a state. It's really important, and you are an essential part of it. So that's what I know that can do that, Maddie, and that's really, unless that just sounds contrary to what you all are thinking, that's really what I think we could help these folks do, just to understand the critical role they play to the state's public safety, and how we just have to tighten our belts now. It's just reality.
Yeah, I would say too, like when you talk about alignment and partnerships, that's what we're doing. We're all doing that. And I look at these recommendations and I think, everyone sitting at this table is working on all of these areas. Instead of just spitting out data to give to you, we can actually talk about these things and tell you what we're doing, as our agency to work on these to help you with that report also.
And that's very much how it felt putting it together. Like, why are you not involved in this process?
Yeah.
I also think too, especially at larger agencies, the information that who we are working with, very much depends on the input that we receive.
Yeah.
And so there's varying degrees of information and just data that's provided to us, and I think that is largely historical. We check the box. This report is better, but I think what our goal is to next year provide a report that all of us can say this is really helpful and this is really good. So I think it will change not just how we're getting and the analysis that we do, but also who we're working with at your agencies.
Well, that was a really great presentation. Really, you've got a lot of interest, and you've got a lot of people that I think are committed to helping you communicate current information and aspirations more effectively. And I think, Bernice, your constituents will be excited to hear that. It's just really important to know you're connected to something bigger, and that you have a stake in making the system better.
Today, and look forward to bringing a fresh perspective to this report.
Anything else before we move on? We're about 10 to the hour, and I just wanted to go around real quick, if you'd indulge me, and see if there's anything anybody wants to share. But Steve, please go ahead.
I'm just going to throw out an idea as a potential future agenda item. If we're serious about trying to reconnect to legislative leadership, many conferences throughout the year will invite the 4 caucus leaders to do a presentation on what they consider the priorities to be of the session. We could certainly invite the 4 leaders in the criminal justice space and ask them to present to us on what they see as priorities and barriers, and then give us an opportunity to offer ideas as well. And I think it might be helpful in terms of that they would be able to create the opportunity to have the communication that we're talking about that we want to need, but it formalized it, like we could do it once a year. And you could schedule it around like a summer correction study committee, so they're already here. You know, it'd be easy for them to come over. So just throw out that as an idea. When we started, they attended more than they do now. And I understand they're busy, and I'm not saying they need to attend every meeting, but one meeting and where they do a formal give and take with JRAC, I think it'd be helpful.
I agree completely. Is anybody opposed to that?
It's a great idea.
I mean, do you all think that we'd have some takers? Yeah, let's do that. Let's take steps to try and make sure that process is in place, and then I want to be respectful to their schedule certainly, but I think that's probably a very important piece of this conference, Steve. I think it's an excellent idea. Let me quickly then go around to Anthony. Anything that you'd like to share from Popeye?
Yeah, Popeye is going to be hosting our Chief Probation Officer orientation in 2 weeks. That's a training that we do free of charge to any Chief Probation Officer that's new in the state, and we've also in the past 5 years have expanded that to invite people that are interested in a leadership position in probation. And then in the next 2 days after that, we host our Management Institute. We have some partners across the state coming to present, whether that's State Board of Accounts, the Association of Indiana Counties, and then also we have the American Probation and Parole Association coming to present this year.
That's great. Thank you for that report out from Popeye. Thank you to you for making the time in your leadership, but to all your constituents for everything they do to keep our community safe.
Thank you.
Yeah. Steve, anything else?
I'm just busy with the session.
I'm always glad when you're able to join us because you always have so much useful information to contribute. It speaks to the need for a strong partnership between supervision, justice, and treatment, so thank you. Becky.
Yes, quickly, I'm not sure if you all are aware that FSSA now has quarterly financial reviews. And while they have the word financial in them, they actually are even more of an opportunity to learn about our programming. There was lots of talk today about crisis and the importance of crisis. It's one of the recommendations. We do report on our crisis data during those QFRs, and the old ones are posted on the website. You can scroll through to the DMHA section if you'd like, or watch all of the divisions within FSSA. We do have coverage in all 92 counties for mobile crisis team response. And then we have 24 crisis receiving stabilization units around our state. So we are very excited. One of the pieces we're focusing on now is law enforcement involvement with those crisis receiving stabilization, because they are an option other than jail. And so we are working with state police and our health family vertical to work on some outreach to law enforcement to increase those referrals and awareness around those crisis units. So we also will have crisis dashboards coming very soon. So I'm very excited to report that. We'll report out on 988 calls, as well as the mobile crisis teams and the crisis receiving stabilization units. And then we also just published a provider report dashboard, so you can go in and look at every county or provider to see how much they're receiving in state funds, how much they're receiving in federal funds, county funds, and then also the number of individuals that they're serving and some of their data. So very excited to have those dashboards.
Becky, many of the same things I said to Doug I could say to you. You've been a long-term partner in these conversations, and so every time I'm able to hear what you've stood up since the last time we spoke, I'm so impressed. Much of what you just rattled off very quickly, and this is important for anybody that might be watching, you go to the National Center for State Courts website and look at behavioral health. and it's going to show you that report that we've been referencing. But that kind of stood out as our guiding light in a lot of these conversations. We had our own statewide report, but it's wonderful to hear about the deployment of all of these crisis response teams, and that was key to what we talked about at the summit. So thank you.
Thank you.
Doug, anything else from CJI?
We're making a lot of changes. So if you hear things and you think maybe that's not right, or you hear things and you're like, maybe we don't know about it and should, please don't hesitate to reach out. We are working to make things much easier for our grantees. We're also working to try to improve our internal operational efficiencies, and so some things in this process might get overlooked, but also I think misconstrued sometimes as we are doing things. So if you hear, just let us know. We're happy to set the record straight. Hopefully it's all good.
Thank you as always. Chris, please, the DOC.
So we've had some great discussions today, and I'm so glad that I asked our brand new legislative director to come today. So I thought this would be a great opportunity for y'all to meet her. I think a lot of you know her. She's fantastic. Sierra Stanko is our new legislative director, and I'm so glad that she was here today to participate in this discussion, because we've had great discussions, especially centered around legislation. So thanks.
Well, Chris, we've worked together a long time, and I just so appreciate how responsive you have always been when we communicate to you and your partners at DOC the needs of our local judges, our sheriffs. You have finite resources as well, and so that's another reason why it's so important for our local partners to understand how to navigate those bottlenecks, how to make the most effective use of those scarce public safety resources, because what we want to ensure is that your facilities are available for public safety threats. I mean, you get them out, but we have as local partners a responsibility to try and figure out what to do with the folks that can be safely supervised locally, and we really appreciate your partnership and look forward to working more closely with Sierra as we try to navigate this this difficult landscape. Thank you as always. Judge Spitzer.
Obviously we're in the midst of the legislative stuff too as well. When I asked the other officers what they thought to bring up, and it was the loss of financial resources or resources for the ability for programming and things like that. And obviously DOC got cut, so they've been unable to fund community corrections and those things the way that they have in the past. Ashley and I have communicated a little bit on that issue. And that's a big concern for our constituents. And I think the thing to remember about that is oftentimes those are alternatives to incarceration. And so when you take away alternatives to incarceration, then incarceration becomes the result. And incarceration is an expensive intervention as opposed to some of those alternative ones. And so in being penny wise, the General Assembly may be pound foolish. That comes on top of really some cuts in resources locally in terms of tax reform, as well, property tax reform too. So it's kind of a double whammy from that standpoint. And so local criminal justice systems are very financially strapped at this point, and so that's really the message to pass on.
Well, Judge, appreciate you as always. I know how busy you are because I used to be your neighbor, and I would also say that I thank you for your leadership of the Indiana Judges Association this year. This has been a very difficult legislative session to navigate because of its compressed time period, and so I know that you've been navigating a lot, and I just wanted to acknowledge that and say thank you. I wanted to just share, we have stood up our new Judicial Resources Committee. And one of the things that we're trying to do is be as efficient as we can as a court system, as a judiciary. Again, I'll say we have a non-unified system, which makes it very hard for us to plan things holistically. There's a lot of discretion at the local level, it's important for us to partner as effectively as we can with all of our local systems, but also our state partners. And one of the things that I'm really interested in looking at is more effectively aligning what our judicial districts do and where they are with what the executive branch does. We partner so closely with them that they're not well aligned. They never really have been. Tried to advance some of these discussions in the past, but for all of these structural difficulties, sometimes those discussions don't go anywhere. I personally feel a greater sense of urgency now because of all of the cuts and that you mentioned, all of the financial constraints that we're all looking at. And so I would welcome your input as our partners, and we'll probably be reaching out to your associations to try and figure out ways that we could, as a judicial system, work more efficiently with all of you. So I appreciate that. Steve, please.
Other than this is my favorite meeting to go to, I will tell you, I love the partnerships and relationships here, and the discussions are amazing. And I've said this before, I tell so many of my other state associations outside of Indiana about the work we do, and it's awesome. The only thing I'll add is I'll help Bernice here on the 1115 medical waivers, and that's probably a discussion that's going to involve Becky, because it's going to, what we'll do is, there's 19 states that have signed waivers, and it will kickstart those benefits, could get them on track earlier before they get released from jail, 30 days, and it's going to improve continuity. So I know that was in the mental health report a few years back, and as to your point, it kind of just stopped. So I think we need to kick that discussion, get that thing going. So I've got a couple contacts who, a group called HARP, who does work through a BJA grant to go around the states to help them implement that or talk about it. So I can help with that. That's all.
Thank you, Steve. Bernice.
Appreciate that, Steve. Good seeing everybody. I don't have an update from the council. We're busy with legislation stuff like everyone else. But good to see you all.
Good to see you. Thank you. Chris.
Okay, I'll try to keep it brief. The last meeting I talked about the secure detention, the use of secure detention that came out of the YJOC. One other thing that I think is interesting, we talked about data quite a bit today, is the data analysis project that's being done as part of YJOC and in partnership with IU School of Medicine. A couple of reports have come out. 35,000 plus unique cases have been looked at over the past few years to look at sort of the gaps and problems with data input for the youth justice system. Not shockingly, missingness, as it is the problem in our drug court study that we're also doing, is the primary culprit here, which all of this ties back to what Justice Goff repeatedly talks about, and the problems with our non-unified system, a non-sort of common data language that we have. Going forward, we are now in the YJOC project down to 6 counties that volunteered a bit more work to be done on trying to improve the processes that will hopefully serve us in being able to not only improve the product that's being given to the youth, but also give us a better way to evaluate what the system is actually doing.
Thank you, Chris. Adam, anything from?
Yeah, just very briefly, sorry. Updating a couple of some of the proposed legislation I mentioned at our last meeting. SB 148, which is the proposal to add LaPorte and Porter County to the Crime Guns Task Force, passed the House Corrections Committee and is headed to the floor on Monday. And then SB 111, which garnered some discussion last time, which was the Juvenile Family Access Bill, attempting to make sure that families had access to juveniles in detention facilities. That didn't get a hearing. I know the senator attempted to amend that into House Bill 1258, but was ruled non-germane, so that's probably not going anywhere now.
Adam, I so appreciate your presence at these meetings, and thank you for keeping the lines of communication open with Senator Pohl and his colleagues in the General Assembly. Thank you. It's good to see you. Carolyn.
I don't have an official update. We're busy with session right now, but I did take notes on today's discussion, and I plan to pass it along to Senator Freeman.
just said to Adam goes as well for you, Carolyn. We really appreciate your presence. We appreciate your participation. Thank you. Ashley.
Yeah, so I'm going to apologize up front because I've got a lot of information to get in a short amount of time. We've got a lot going on at IACAC right now. First, I would like to mention Kim Churchward is the director of Allen County. She is retiring in May. She has dedicated over 40 years of her career to our field. She'll be tremendously missed, but it would be a miss if I didn't notice her impact not only locally but statewide to our association and her community corrections there. Secondly, regarding data, that has been one of my charges as president this year, is I really wanted to get a good sense of data from community corrections across the state. So I put out a survey, I harassed a lot of people, and I got a response from all of our agencies. And that information is very important, and I will come back to that. But regarding the financial impact of the reduction in our grant award, the Justice Reinvestment Advisory Grant. Just for perspective, in 2025, there was $72.5 million awarded. In 2027, there will only be $52.9 million awarded. That is a $20 million decrease from 2025 to 2027. There were 251 entities that received grant funding in 2025. Last year, 234 received grant funding, and I can guarantee you that number is going to be decreased for 2027. That means we're going backwards. And I say that to say the purpose of JRAC, the purpose of what all of us around this table are doing is rehabilitation, keeping people out of the criminal justice system, and the impact to our local associations straight from the mouths of the directors are residential programs will be closing. They will be eliminating program and supportive services. Programs will become reactive instead of proactive. Reduction in programming such as peer recovery will happen first. Change in eligibility criteria, they'll serve less offenders. There will be hiring freezes. All of these things will lead to increased jail populations and increased DOC populations. So when Bernie says, 21% of placements are DOC placements, that number will significantly increase as these programs are eliminated. For data reference, we have 78 agencies across the state that are community corrections agencies. Of those 78 agencies, 22 of them are considered combined. That means they're community corrections and probation. 41 agencies of the 78 have certified programs through IOCS. That is a 52%. That means those certified programs that IOCS is doing an amazing job with, which are all evidence-based practices, research-driven, and have real high impacts, will start to be eliminated because these agencies will start to be dwindled down to bare necessities. We will be going back to public safety because that is our priority. All of the extra things we've been doing along the way that have made huge impacts on these local communities, they all go away, and we're terrified. Our association is working very hard. I ask all of you to get with your members, let them know, talk to your local agencies, let your local agencies know they're not alone, they're not supported, that they're not on a cliff by themselves. Another big piece of data that I got from our survey was of our 78 counties, 69 of them received county support, either through direct county funding or through in-kind support. So 69 agencies, that's 88%, that are being supported locally that would not be able to operate without local support, but will not exist if there is not grant funding either. So it's a big deal. It's hitting us really hard, and we know that there's not a lot we can do for 2027, but we are trying to figure out how we can work together and partner with anybody and everybody to really make a difference for the next fiscal budget cycle, because the local counties will be impacted, the state prisons will be impacted, which means everybody's bottom line is significantly impacted because it's not penny wise, it's not efficient, it's not our per diem at a community supervision level. We're a quarter of what the per diem is at a state or jail facility. So I just implore all of you to really touch your local entities, all of your members, and encourage them all to get to their local JRACs and have these conversations and figure out how we're going to get through this next year together.
You know, Ashley, I would also ask you to encourage them to, it's a wonderful idea from our executive director at IOCS, invite your local legislators to your local JRAC to help educate them on the important work that we do collectively, because everyone shares a concern with public safety. And I think everyone understands that there are financial constraints that have not been present always in years past. So helping those members who are on a very compressed time schedule understand the important work that we're trying to do to make sure that these programs are resourced up adequately, ensure that there's bare minimum public safety available in all of our communities, really depends on their support. And I would also say, please convey to your members, I'm sorry we've not been able to deliver more. I truly am, but part of the discussion today, really the primary driver of the discussion today has been the folks I know you serve with and the folks that I know Steve serves with, because they're really the tip of the spear, and they are under tremendous strain. And anything that we take away to serve that core public safety mission, you know, this is not we're not in the politics game, we're in the public safety game. And so it's just really important for people to understand that. So I thank you for your leadership, and I thank you for sharing your candid concerns. Danny, are you still with us?
I'm still here.
Danny, I probably thought about calling you sooner because I was afraid I was going to forget, but I just want to thank you for being here as Governor Braun's designee. And you've been able to hear the discussions today. Is there anything that you'd like to share from the governor's office in terms of public safety, or anything our members should be aware of?
I did want to reiterate one thing that Becky said about the critical response teams that are being developed and have been developed. I've been able to be in some of those meetings, and I think that is a huge thing for our first responders. For years, they've had two choices if they come across a mental health issue: jail or hospital, and neither one of them will always be the best answer. So I'm really excited about that. So I'm glad she brought that up. And other than that, I appreciate the presentations today and the great work that Doug and his people have done as well. And I appreciate your patience. I'm sorry I was absent today. I'll try to do better next time, but couldn't be helped. But thank you.
No, it happens, and we understand it. I appreciate your participation, and we look forward to working with you and the governor to tackle these issues. So thank you. And is there any other business to bring before the council? Very well, then we will stand adjourned. Our next meeting is April 17th, 2026. Same location, but across the hall in Fuse Center East. So
Can I just add to that? Megan Morgan will be here to do a presentation about
in jail.
So
Great.
The developments, Sheriff Luce had asked for it for this month. She's busy, and she has agreed to be here next month.